Hello everyone, my name is Chris Stevenson. I'm the Director of Marketing here at Broadspire, and I'd like to welcome you to our OnDemand webinar, COVID-19, Restoring with Compassion. This is one of many resources we've created to offer guidance to those impacted by the global pandemic. We're taking an organized approach to this and have built a robust library of information available for our clients, partners, and internal team members. And many of the resources we've created can be found on our website, with more detailed information and updates available from your Broadspire account executive or your main contact. We'll have the full URL of the COVID-19 site available in the description of this video. I'd like to introduce our speakers today. We have 5 thought leaders and experts within Broadspire we can be speaking with. Mike Hoberman, our Chief Client Officer, Erica Fichter, the SVP of Medical Management and Accident and Health, Mark Cunningham, SVP of Disability and Leave, Cynthia Curd, National VP of Claims, Operations, Quality Compliance, and Verna Jackson, VP of Case Management. With that, I'll turn it over to Mike Hoberman.
Thanks, Chris. I hope this finds you and your loved ones healthy and well. It's certainly safe to say these past weeks have been some of the most turbulent and emotional than any of us can remember in our lifetimes. The impact of the coronavirus outbreak has been felt by individuals, families, businesses, and communities across the U.S. and around the world. The response to this crisis has been extraordinary from both the perspective of what it has required us to do, as well as what it has revealed of us as a people. We have a profound need to be connected and supportive of one another. With that spirit in mind, we've created our crisis support solutions and resources library for both our clients and our employees. Before we begin, let's take a brief look at where we are as of today. As you're aware, these numbers are constantly changing, and these numbers will probably be out of date by the time I move on to the next slide. As of this morning, weekly jobless claims have climbed to over 10 million. And so we want you to look at the scale and use these numbers to show that no matter what sector or industry you're in, everyone is impacted by this. With our mission of restoring lives, businesses, and communities in mind, we set out to create empathetic and supportive solutions for our people and our clients. With that, I'll turn it to Erica.
Thanks, Mike. During this unprecedented time, communication is key. Beginning internally, communicating with employees should be the #1 priority for those of us managing claims. We need to help them understand the situation from a business perspective and how we can proceed together. We want our clients to have a seamless experience, so it is important that employees are able to keep things moving along with our clients. In addition, communicating with clients throughout the process is key. We cannot just send one message out and then go back to business as usual. Keeping an open line of communication while things change is critical. It is important to understand that the world is changing and acting accordingly. This includes modifying service offerings to accommodate social distancing or shelter-in-place directives, staying on top of jurisdictional updates to make sure we are ready to make necessary adjustments to our programs, that our clients remain in compliance. We need to double down on compassion and empathy. Ultimately, we have to do our jobs, but an extra touch and care required at this time. Someone with an injury that occurred 2 months ago is still injured. They still need care and attention. They are also impacted by the crisis, and there is a good chance their lives become more complicated and confusing. We are in a unique position to help offer some guidance and solutions to people in a time of great uncertainty. These are all things we are seeing across many of our clients and partners, and we are doing here at Broadspire. Now, to get into the details a little more, I will turn it over to Cindy Curd to discuss regulatory changes.
Thank you, Erica. Last month, we talked about the impact of COVID-19 on workers' compensation in our white paper in great detail. Since then, the impact of the virus has continued to morph into a situation few of us could ever even have possibly imagined. A month ago, we started with each state having their own statutes in regard to occupational disease. And although different, most states considered two main things: whether the illness arose out of employment and whether the employment itself put the employee at a greater risk than the population in general of contracting the virus. Now we're seeing states implement changes to accommodate these unique set of circumstances that we find ourselves facing with COVID-19. We're seeing in-person hearings have been routinely canceled in every state that I know of. Many are being held telephonically. States are looking at their statutes and discussing changes that reflect the effects of the pandemic. As an example, Michigan has implemented an emergency rule which creates a presumption that first responders will have a compensable work-related injury if that employee meets one of 4 criteria they've set out. Some states are also extending statute of limitations in certain areas. We're also seeing telemedicine become much more common after facing challenges on acceptance in the industry. I have no doubt that this is just a start, and we will continue to see additional changes in the coming weeks and months. Now to talk about leave and related benefits, I will turn it over to Mark Cunningham.
Thanks, Cindy. With an appropriate sense of urgency, Congress was quick to act on working on a law and having that signed into effect on March 18, 2020, named Family First Coronavirus Response Act. This law is in effect as of yesterday, April 1st. There's multiple parts, but 2 in particular that I'll focus on are the expansion of FMLA, labeled the Emergency FMLA Expansion Act. This law focuses on, or this provision focuses on employers with less than 500 employees and all public employers. It's focused on a pay continuation for 2 weeks, 80 hours more specifically for full-time employees, and for part-time employees, the equivalent of their 2-week schedule. It's due to quarantine, isolation, symptoms, also caring for someone with those same impacts, as well as watching over a child due to school closures. The second pay component is labeled Pay Sick Leave Act. And this is a partial pay continuation that is also focused on employers with less than 500 employees. It's 10 additional weeks, so this is an amendment to FMLA, so it's still a total of 12 weeks, and as I mentioned, partial pay. In addition, states are also focused on their ability to address this matter. New York, for example, has amended their New York DBL and PFL, so their disability plan as well as their paid family leave plan, and their focus is on quarantine and pay continuation during that period of time. I'd also say that California, to name one, is expanding their paid program to look at quarantines. State of Washington is looking at this as well, and New Jersey and others are still debating on how to address this from the standpoint of their definition of disability within their state disability plans. To expand on what we at Broadspire are doing, I'll hand it over to Mike Hilderman.
With our people and clients in mind, we looked across our entire global enterprise and applied our vast array of products and services to meet the nuanced needs and challenges this crisis has presented. We crafted specialized support services from customized intake through specific claim, clinical, and care management support to our highly sophisticated modeling and analytics capabilities to allow for greater visibility and informed decision making. Now I'll turn it to Erica to begin to walk you through some of the specific ways we've been able to respond to our clients at their most critical time of need.
Thanks, Mike. Our 24/7 claims intake will support any types of COVID-19 related claims at any scale. We have moved all of our call center employees to a work-at-home status to protect our employees and to deliver excellent customer service. We have worked with our clients hand in hand during this time to customize our services to meet their needs. Our advanced technology and system capabilities have allowed us to help ensure the flexibility and capability to achieve these results. This flexibility enables Broadspire to offer a global response for all of our carrier partners and corporate clients for a well-rounded solution. Clients may continue to submit their claims through any channel, email, phone, online, or other existing platform. I will now turn it over to Cindy Kurz.
Thank you, Erica. We've implemented our business continuity plans so that our claim handling continues seamlessly, and we maintain total oversight of our critical claim decisions, with payments and those decisions receiving top priority. The majority of our staff is working from home. We do still have some essential staff that have to go into the office. All of our handling personnel have been updated on the protocol that is specific for this very unique type of claim, so that we have consistent handling across our offices. In addition to utilizing our best practices, we've updated our occupational illness and statement criteria and claims handlings, meeting with the adjusters to ensure any questions are handled. We've undertaken internal identification and coding on every COVID-19 related claim that comes into us. We ensure that our claim operations senior management, client services senior management, and the applicable account executives are made aware of all new COVID claims that are received. This ensures that we keep our clients and partners up to date on our current activity. And now I'll turn it over to Mark.
Thanks, Cindy. As we look at our technology as well from a broader benefits perspective, thankfully we were well positioned for our reaction to and our response to the needs within the leave of absence and general absence management space. Using that existing robust technology and analytics, we're quickly able to adapt to the new legislation that I mentioned earlier related to the Families First Coronavirus Response Act. That specific law is focused on employers with less than 500 employees, as I mentioned. We were quickly able to stand up a provision within our absence portfolio that allows both existing clients and also clients looking for a temporary solution to be able to provide compliance, time tracking, and payment support for employees that are within that immediate need. Additionally, for existing clients and also employers that are looking for a temporary solution that are greater than 500 employees, we are also able to support those both on a long-term basis as well as a short-term basis that may align with most of the provisions associated with this law that sunset following December 31st, 2020. These solutions are nuanced within our normal portfolio. We've simplified the intake process. We've removed the typical implementation requirements that allow us to provide this solution in an expeditious manner. And we limit the exposure to clients based on providing day one compliance.
Thanks, Mark. We're going to dive a little bit more into the medical management and talk about 5 very specific solutions that will help during the COVID-19 pandemic. Let's start with nurse triage. 24/7 nurse triage with telemedicine continues to provide a clinical resource and service and may help reduce unnecessary trips to doctors and hospitals, with as many as 37% of calls resulting in self-care. If you do not currently use this service and would like to add it to your program, please contact your account executive. Berna is now going to go into some detail specifically as it relates to our case management programs.
Thank you, Erica. I'd first like to talk about our complex case management. When working with our long-term traumatically injured workers' compensation claimants, our case managers will continue to provide simple wellness checks to help ensure our population of amputees, quadriplegic, paraplegic, or brain-injured clients have all of their needs met. Whether it's a new piece of equipment that is needed or a physician visit that needs to be scheduled telephonically via telemedicine, our Broadspire care managers are here to help. When a crisis such as the global COVID-19 pandemic happens, the lives of your employees can be filled with anxiety, fear, and uncertainty. Our specially trained case managers can also provide interventions that will assist with the individual's myriad of psychosocial needs. Our care managers also act as client advocates, medical advisors, or surrogate family members, and they're available to work with our elderly, special needs, chronically ill and disabled clients to assess ongoing needs and recommend options for the care of our loved ones. As the situation continues to unfold, we will continue to assist when making care decisions involving this most vulnerable population. Erica, would you like to talk a little bit more about telemedicine and telerehab?
Sure, thanks, Verna. As we all know, the need for medical care does not go away as social distancing and quarantine protocols expand. Telephonic care provides an opportunity for impacted individuals to receive the medical attention they need without leaving the home. This will help facilitate many return to work strategies that our clients may have some concerns about on how are we going to continue the treatment of care for individuals. So I will leave you with telephonic medicine and telephonic rehab are key to continuing patient care.
And Erica, given the challenges this crisis has presented, it's certainly an interesting one for telemedicine, as arguably the industry has been somewhat hesitant to fully adopt telemedicine at scale. And this may be the tipping point, since, as you mentioned, the care must continue, and this is one of the few options to do so safely. Considering some of the customized support solutions we've covered, we know the need for informed decision-making is even more critical during this unprecedented time. Sophisticated analytics support and precise data capture become the keys to shape learning and continual improvement for claim and clinical outcomes. We are using our proprietary models and tools to show our clients various visualizations on their claims associated with COVID-19. We can also overlay these claims on public figure and provide interactive dashboards to allow for greater insight. We also have our data scientists working on our sophisticated models with over 300 variables and metrics available to diagnose trends and to possibly use public data to project hotspots a week into the future. For example, this can be compared to a client's location hierarchy, possibly weighted by historic claims, to get a sense for where the heavier populations of claims exist, to help a client know how at risk their employee base is. We will continue to work closely with our clients and help them use data to make the most informed decisions to help them protect their employees, their operations, and improve their results. Turning back to claim resolution and support, and considering the gamut of coverages potentially impacted by COVID-19, we looked across the entire Crawford enterprise and identified a variety of different services currently in flight for our entire client base. I'd like to first ask Erica to touch on some of the creative ways we're utilizing our accident and health and affinity models to help clients.
Thanks, Mike. As we move deeper into uncharted territory, consumers will look to protect themselves now more than ever. Trip insurance against cancellations, sickness, and other environmental factors may become staples of planning any travel. We are prepared to support a wide range of affinity and accident and health programs for travel insurance needs and beyond through our accident and health and affinity claims unit.
Thanks, Erica. We know there isn't a business or industry sector that isn't impacted by some form of disruption or business interruption at this point. With our global network of forensic accounting specialists, cyber teams, and Crawford team of business interruption experts, we're well positioned to help clients assess the economic impact this pandemic has created and evaluate any resulting losses. Through Crawford's Contractor Connection Network, we have specific services built around cleaning and decontamination for commercial businesses, which includes over 700 credentialed biohazard contractors across 50 states with 2-hour emergency response, all with rigorous quality management throughout the process. For clients taking advantage of Crawford's vast array of field adjusting services, we are able to continue supporting you through our remote claims management solution. This includes intelligent triage and using a combination of desk adjusting, video collaboration, self-service apps such as YouGoLook, and other innovative solutions to help clients save time and money, close claims faster, and enhance policyholder satisfaction. Chris, I'll turn it back to you so we can launch into our frequently asked questions.
Thank you, Mike. What we want to do now is share some frequently asked questions. These are real questions that we're getting in from our clients and partners and people that we're doing business with, and we want to share these with everyone in hopes that it might help some of you out there in the market. We'll start with a couple questions from the disability and leave side of the business. And I'll direct this to you, Mark. Are you liberalizing medical documentation requirement for leave claims? If so, what are the criteria or modifications to your standard?
Thanks, Chris. As a third-party administrator, we remain flexible and align our philosophy with our specific client needs. So in this case, we are accepting other medical documents, such as office notes or medical documents that have been notated in a way that's typically outside of what we would expect from a standard attending physician statement. But we are accepting those in lieu of that particular or typical physician statement. We're also accepting self-reporting for pregnancy and bonding with documentation to provide at a later date, but again, that's client by client.
Okay. And are you approving those diagnosed with COVID-19 for short-term disability?
Yeah, we're working with our clients to really see how they want to address this. In some cases, clients are asking that they actually expand their current disability program to define COVID-19 as a covered condition. In other cases, they're not modifying their plan at all, and they want us to treat this as we would any other condition and to manage it accordingly.
All right. And along those same lines, are you waiving short-term disability and leave requirements to provide medical certification?
Not necessarily waiving, unless a client does ask us to do that. We're definitely extending the due dates. We understand that medical providers aren't necessarily as available as they were in our previous norm. So we are basing it on client requests, as we do typically within our normal administrative offering. But as a best practice, we've established a minimum extension in light of how we see the current environment and availability of those types of resources.
Great. Thank you, Mark. So Cindy, our next question is around the compensability of COVID-19. You mentioned the white paper that we created before, which goes into more detail on this, but you're just asking it here, is COVID-19 compensable, and if so, under what premise?
It can be, and then again, it cannot be. And I know that's not really the answer that we're looking for here, but every set of circumstances is different. Every state has different laws and requirements. So it really depends upon the circumstances of the claim, the job the person is doing, and the state that they're located in.
Okay, perfect. And so expanding on that idea a little bit further, what if an employee thinks they may have contracted COVID-19 from a customer?
Okay. As with any workers' compensation claim, if an employee thinks they were injured or that they contracted COVID-19 from their employment, they need to report the claim to their manager. At that point, the claim would be sent in to us and we would start the applicable investigation on it.
All right. And a somewhat similar situation, what if they think they caught it from a fellow employee, one of their coworkers?
It would be the same set of circumstances. They would report it to their manager, and a claim would be called in, and we would start the investigation.
All right. And so taking the first scenario, twisting it around, a customer comes in one of the store locations and alleges that they contracted COVID-19 from an employee that works at the store.
Okay. At that time, the store manager would report the claim to, if Broadspire, if we were handling their general liability claims, of course, and there would be an investigation started on that. So the same set of premises, it's a different line of business. An employee, it would be workers' comp, a customer alleging that something happened because of a store employee would be under their general liability policy.
Okay, thank you very much. Erica, the next question we'll direct toward you. Obviously, employers want their employees to stay separate, to sanitize, stay home if they're sick. What other resources would we suggest that employers share?
As we have seen, this situation is rapidly changing. We suggest referencing the CDC website for the most current recommendations.
Okay, perfect. And the last question, there's concern about exposing otherwise well but injured employees to urgent care facilities and more particularly emergency rooms. What do you suggest that employers do in this situation?
Verna, would you like to speak to that one?
Sure. Chris, we would urge one of these two options. Number one, the use of telemedicine, as they can assess and provide medication and offer advice as to whether the injured worker really needs immediate treatment. Number two, implement the use of our 24/7 nurse triage, which is powered by medical. And that's going to involve the same as using the telemedicine, plus there will be assistance with referrals to network providers and a free resource for follow-up calls and much more. With each workers' comp incident, a risk-benefit analysis also needs to be conducted to determine if the injured worker really should go to the ER or urgent care versus waiting for an in-person visit with a doctor in a private office. So we would advise asking the following 4 questions. What is the risk of going into an emergency room or an urgent care immediately following the injury versus what is the benefit of going to an emergency room or urgent care immediately following the injury? Also, what is the risk of not going to the ER or the urgent care immediately following? And also, what is the benefit of not going to the ER urgent care immediately following the injury?
Great. Thank you very much, Verna. And I want to turn it over to Erica for a few parting words as we round out this discussion.
Thank you, Chris. We want to leave you with these parting thoughts. In a time of unease and uncertainty, acting with compassion and empathy are traits which make us human. We are all in this together, and Broadspire is proud to work with everyone across the industry to do what we can to help us come out the other side of this crisis stronger, smarter, and with a greater appreciation for life and each other.
Thank you very much, Erica, and thank you, everyone. Want to remind you to please check back on Crawford's website at crawco.com for additional resources on our response to COVID-19, as well as follow our social media channels on LinkedIn to find more information.